Okay, here we go. Starting with the knee, we're going to target the upper legs, quads, hamstrings, get into the lower leg, and then finish with the hips. So as we extend the length of the STARwrap by adding the extension strap, having the logos face the same direction, we'll have plenty of length to go around the leg. We're going to use a linear activator, and we're going to place that across the muscle fibers, making sure we're avoiding tendons in areas surrounding your ankle, your knee, and your hip. So no tendons is placed directly on the muscle fibers. We're trying to find bundled tight tissue. And so palpating, finding a good trigger point to begin, and apply the linear activator across the muscle fibers. You want to undo the compression strap to get a secure fit. And then you're going to strap, wrap, and go. So you can seal that final strap along the compression strap. And we're beginning with movement exercises to activate the quad muscles. So pretty much any movement, lunges, squats, any type of movement that's going to stimulate blood flow into that quad, lateral quad group. The curtsy lunge, there's all types of different movements you can do. To increase the pressure, add your hand in a seated position to the STAR activator, pressing directly into it. You can really affect the directional pressure by using different angles to apply pressure. And then we're going to move into the Rectus Femoris muscle. So a lot of times knee pain is coming from tension and tendon tightness and inflammation around the knee joint itself, which is caused by tight muscles. So the idea is we're going to release all the musculature above and below the knee joint, or whichever joint we're working on, and get that tension relieved out of the muscle tissue, and consequently the tendon, the inflammation, and a lot of times the pain is just going to dissipate. So targeting those areas that you find that are bundled and tight, and then moving and activating the muscle under that focal compression is going to bring the body the stimulus it needs to adapt and transform. And those are the two most important factors related to muscle tissue transformation, is force and consistency. So we're applying this a good amount of time, 15-20 minutes per site, and this is making a bit of a paradigm shift on how we treat our body, and really focusing a little more on recovery and getting the muscles what they need in order to get restored back to a healthy state. Okay, again, we're palpating the Vastus Medialis now, finding a good trigger point, staying with the linear activator across the muscle fibers, strapping it on, making sure to stay off the tendon, so we're not too close to the knee, but a few inches above the knee, the patella, and staying off tendons, onto the belly. Continued movement exercises. The body will adapt to this stimulus, you just need to give it enough time. So continue your movement activation exercises. These are just some examples of ways to apply increased pressure and just a focused effort on stimulating muscles, but basically walking around will still give you that same desired effect. Moving in with the Specific Activator and targeting the popliteus, which is right below the back of the knee, and this is a very important muscle related to the position of the tibia and the femur and the bones of the leg, and as well as pressure that's building up from hamstring attachments and calf attachments on the back of the leg. So this is usually, I find it extremely sensitive and tender with most athletes dealing with knee pain, so it's a very important area not to overlook, and zero in on that popliteus muscle. So now we're moving into the hamstring group. So we have the Biceps femoris long head, which attaches on the ischial tuberosity, or the base of your sit bone, and the sacrotuberous ligament. All three of the hamstring muscles that we'll be talking about are attaching on the sit bone, and underneath them lay the adductor magnus group for your groin. So a lot of tension on the base of your hips related to the attachment sites of the hamstring muscles, and then they're attaching as well on the head of the fibula and lateral condyle of the tibia. So a lot of anatomy jargon there, but basically we're targeting the backside of your leg, stimulating muscle tissue, and trying to get as much activation and release from those hamstring muscles, which are directly affecting your knee pain. And So we're starting now with the semitendinosus and moving along the length of the muscle, just targeting laterally, and now we're going medially. Compress the extension strap and activate the muscle, and just continue moving that activator and STARwrap up and down the length of the muscle, targeting in 15-20 minute increments. Whenever we're dealing with larger muscle groups, we really want to apply enough time moving it up and down the leg and force, so using the chair to add a little bit more pressure to really dive deeper into those muscle fibers. They've been building up tension and we need a lot more stimulus to get them activated. Finally, we're ending up on the soleus and getting into the soleus and gastroc on the calf muscles. This is based on anatomy trains and some of the structural integration work I do, so we're really following that entire back line from the heel all the way up into the hips, and as well we can get into the spine all the way up to the head. So moving along the back of the leg and calf, and then moving laterally into the perineals, again staying off tendons, making sure we're targeting that lateral line as well as the back line to relieve all the tension around that knee joint. Next, we're going to deal with anyone out there with shin splints. A lot of times the perineals are the muscles involved, so we're going to follow up and down the length of that lateral leg, trying to find an area that's problematic. Okay, we're moving on to the floor and really zeroing in on the tensor fasciae lata, which is above the head of the greater trochanter. So we're using the Specific Activator, which is the most precise stimulus of any tool on the market, and we're giving it a good targeting of one specific area, muscle bundle, and just hang out there. Find a place that stimulates, that's about a 6 or 7 on the pain scale. Be very careful with this area as well. You can get into some nerves and uncomfortable areas closer to the pubic symphysis. So staying laterally. Now we're moving into the quadratus lumborum and glute medius, and using the foam roller on the ground. This is the most intense pressure by using your body weight. So if this is too intense for you, you can lean up against the wall and use the wall with a little less force. Okay, and we're finishing up on the upper thoracic here, just right between the shoulder blade and the spine. We're going to again try to find some fibers along that area that are tight and bundled, making sure to stay off the spine, and just move the arm forwards in front of you overhead to activate the muscle.